You're always learning, and it's field visits, meeting with scientists, looking at the numbers. It's a collage of those things that come together. For our health work, it's been figuring out how primary healthcare systems can be really well run, and that gets you the vaccine coverage, it gets you teaching the mother about things to do before birth and after birth, it gets you the nutrition things, the reproductive health supplies. So that it's amazing how some countries spend very little on their primary healthcare system and they get 95% of the kids vaccinated, and some spend a lot more and get 30%. The importance of personnel systems and helping get those rights, the measurement, training, hiring, and I'd say in our U.S. education work, it's been the most dramatic, where we were focused on school and school structure, and not so much in the first 4 years on helping the teachers learn from the very, very good teachers. And that shifted around because we saw about 10 or 15% improvements with the thing we called the Small Schools Initiative, which, given the gap between what's happening particularly in the inner city and what should, that just wasn't going to be enough. So we got very focused on how do teachers get feedback, what are the exemplars doing right, can you help people improve? Essentially personnel system, and not just the compensation piece, because that turns out to be secondary to the idea of professional development, analysis, and measurement. So it's, it's kind of obvious, I guess, at this point, but it took a lot of time and money to have that be a primary model that we apply.
Applying transparency to development actually was a big lesson for us, because it's strange, but the two parties who are most important in the transaction that we call development assistance are the two sides of the equation who know the least about it, which is extraordinary. The taxpayer and the child who's been vaccinated, or the student who sits in the class. That has got to change. And I think it'll be wonderful when it does.